Now welcome to the stage, physician, clinical associate professor, and Flutter GDE, John Manning.
Let's just start with the obvious. Yes, there is a doctor in the house. And if anyone gets sick, I'll help you to the best of my training and ability. And while many of you are probably thinking, what on earth is a physician that cares for patients doing up on stage at a GDE summit? Well, guess what? I'm wondering that myself sometimes. But even yesterday, when Andrew Brogdon introduced me as a longtime Flutter GDE to another Googler, it let me know that this is part of my professional home. So thank you all, every one of you. You are part of my professional family. You may be wondering, what on earth are all of these letters at the end of my name as well? And we'll get to that. But I'll point out that this is a lot more of a personal talk to explain my journey in a way that helps hopefully be useful for you and for the next generation of GDEs. Let's just start with the easiest. All right, so right on the right side, you see FHIR Juun, you see Flutter Juun. I have a company made Juun. Juun, that's the easiest month. It's my birth month, and it's an old nickname from college. Flutter, it's probably obvious at this point. For FHIR, raise your hand if you've ever heard of FHIR-FLI. Okay, so a small number. That stands for Fast Healthcare Interoperability Resources. It is the global standard for interoperable exchange of health data. Designed in 2012, it is mandated by law in the US for patients to have access to their own data from medical records through this FHIR format. It is the exchange of data. And while we build a lot of stuff with FHIR, no. FHIR Juun actually predates this. I juggle FHIR. And I have for almost 20 years now. Torches, staff, double staff. Juggle and spin. Yes. Yeah, come on. Yeah, woo. That's a safety move. Everyone, that's the safety move. And actually, this is me in med school prom, which was fun. Normally, for those of you who know me, I'm a quiet person. There are only 3 times in my life where I truly find my voice. One is on stage, like today. One is in a performance of FHIR arts. And the third is as a physician, caring for patients at their sickest for medical and trauma resuscitations. Because I have to be loud and I can't be over loud. There's only a few times that I need to find my voice. Back in residency, one of my mentors called me a master of resuscitation. And why is that? As a normally quiet person who finds their voice and does it with effect, it's because I used this other part of my life that was important as a FHIR performance artist to directly help me be a better resuscitationist at the bedside. That's important as you're thinking through your next path as well. So this will be a little personal, but in a few weeks, I'm about to be 40. And I've been spinning FHIR for half my life, which is crazy to think about. Yes. I did a typical traditional medical path as a first doctor in my family, which was over half of my life in education. Emergency medicine is my specialty. I have a subspecialty of clinical informatics, which is that blend between technology and the bedside. And I never took a single computer science course in high school or college, ever. And I never took any formal training in FHIR juggling either, for whatever that's worth. Lots of videos from Megan Claire Pike, 6 months of testing, and then finally going out to FHIR conferences called Wildfire. In technology, my path is interesting because my mom was a PhD mathematician and entrepreneur during the race for the human genome, and my father was labeled as a design engineer who built robots in our backyard. So growing up, I helped build sonar parts for the Navy. We had a cool idea that we designed, built, and prototyped that, get this is a great idea, it'll hold VHS videotapes like a vending machine. Wow. It actually, the prototype held 1,200 VHS or 2,500 DVDs, had a CRT monitor and a touchscreen overlay that even an 8-year-old could use and could get to any of them in 30 seconds. And while the hardware worked great, the software was a little too buggy and it would crash after 40 minutes. And unfortunately, that's what killed that idea from our perspective. Years later, as a medical student learning about informatics at the National Institutes of Health, I fell in love with this idea of human-computer interaction and usability. From Ben Schneiderman, the guy who put the HT into HTTP and invented tree maps, amongst other things. And that brain for design started heading towards one of, well, maybe I can do medical design. That would be really cool. A few years later, I pitched an idea for an app at an emergency medicine conference and got the grand prize and the EMS prize. A year later, we were pitching that as our concept on the front of a stage as part of a keynote. This path is why I became an Android developer, and then later Flutter in tail of 2018, early 2019 when it was released. So at this point, as an educator, I think it's pretty confident to say that I am a clinician, educator, entrepreneur. I care for patients. I teach people how to do that. I build technology that's open. And as you can guess, my time is limited. Whenever I give lectures like these, I record them so that others can be able to use and expand from that. So those letters at the end of my name are lifelong badges of honor. A fellow of my first specialty, the American College of Emergency Physicians, or ACEP. A fellow of my other specialty, clinical informatics, the American Medical Informatics Association. And each one tells a story of at least a decade of service, committee work, projects, and something that is contributing to the specialty beyond me. But from a technology perspective, and there's always an underpinning for this, these hackathons that promoted the idea of becoming an app developer, as well as, after I had this fellow status, we were a vendor for the American College of Emergency Physicians, and we built a content management application that connected to Firebase and had 10,000 downloads from a roster of only 50,000 emergency physicians in the US. Over to the informatics side, the very first true live coding experience I had, where I recreated part of this major conference's app in 2 hours with no notes and just from scratch introducing Flutter and talking through a lot of the design principles that were a part of this. FAMIA reached out to me, that group, that later that day and said, hey, can you just record that again and we'll have it as a continuing medical education offering? And I did. That's why there's a YouTube channel. That's why there's videos. And later, when the continuing medical education part had expired, they gave me the content back, and it's up freely available on our YouTube channel. The interesting thing about this one lecture was that there's about 100 people that I did live coding in front of. And one of the people was an informatician in Philadelphia. And 2 months later, the next fellow, or round of fellows, one was I'll just say underachiever, because he's internal medicine, pediatrics, lived and practiced in 8 countries, spent a year in Uganda, and then did 2 fellowships in global health and then informatics. So definitely an underachiever. Developer, mind you, he should be a GDE, let's just say that. Was interested in Android in some of the countries where he had practiced. And a co-fellow from that one lecture said, well, why don't you look at Flutter? 6 months later, we're collaborating, building the standard that connects to FHIR, called FHIR with Flutter Library Integration. It's worth noting that that ingests about 8 million lines of JSON of all published versions of FHIR, including the test cases, and exports about 2 million lines of Dart, so that you have the serialization and deserialization, you have authentication and authorization, you have the RESTful APIs, and you have the custom scripting like FHIR path that allows you to transform these data elements. Architected primarily by one person, which is incredible. Since pub.dev has been giving us how much our impact is on a broader scale. It's about 15 to 16,000 downloads a month. And we've had direct contact with developers in 7 countries that have been using this specifically for healthcare. Put simply, if you're building something in Android today, native, use OpenHealthStack. It was architected and supported by Google. It's great, it's excellent. But if you're going to build something in Flutter that connects to healthcare data, and if you're doing that, just use FHIR. Use FHIR-FLI, because there is nothing out there today that's its equivalent. And this all culminated on me as a very high honor being on a keynote, closing keynote presentation for the 2022 International FHIR DevDays event, which alternates between the US and the Netherlands. And those other 3 I'm on stage with are e-patient Dave de Bronkart, who was one of the pioneers of patient personalized health records and open notes and allowing you as a patient to have access to your own data. Viet Nguyen is a pediatric medicine informatician or informaticist who at the time was on the board of the international standards organization called Health Level 7 International that helps promote and develop and support the FHIR standard. He's now their chief standards implementation officer. And Ewald Kramer is a Dutch technologist from FHIR-FLI who is one of the 3 people commonly cited as the FHIR chiefs who first invented that standard alongside Graham Grieve in Australia and Lloyd McKinsey in Canada. This was a massive honor. So what are we doing today? And let's bring it down to the bedside. This is Tim. Tim is 73 years old. He just finished mowing the lawn. And man, his chest is just really tight. It's not painful, it's uncomfortable. And it goes up into his jaw, and his left arm is a little bit numb, and he's really dizzy and nauseous. And his wife notices that he's really sweaty. She's worried about him having a heart attack, which he is. He's having a massive heart attack right now. She calls 911. He lives in an urban area. He's 5 minutes away from a hospital. He goes to a major center that can provide a balloon or a stent. It's called a catheterization lab, and he has a great outcome. Well, if Tim lives 30 minutes from a hospital, or if he lives in a very rural area, his likelihood of having this great outcome goes further and further down. And we know that the time from first medical contact to this intervention that's life-saving of 90 minutes, after that, every minute is a linear increase of bad outcomes. And if he's in an rural area, he has an 8-fold likelihood of having a bad outcome to begin with. So we built a functionally sourced cross-platform Flutter application through a grant through the Agency for Healthcare Research and Quality. I say functionally sourced because if you want to use this in any fashion that is not as a direct competitor, great, it's MIT, use the code today. If you want to do this in direct competition, then you just have to wait 2 years. This application followed a whole design thinking process with one of the 8 counties that we're going to be implementing this in, from exactly what do you need from navigation to the specific patient data elements to the notification of these to these large health systems of what information will help activate his care with as little delay as possible. This is really just navigation with the addition of healthcare data and notification as well. And when you think about the various APIs that we're using for this, so apps, maps, routes, Firestore, and Google's Cloud Healthcare API, each one of these is its own story that we can absolutely unpack. And as was mentioned earlier today, as opportunities for GDEs, literally in a few hours, we'll be recording that first of these lectures, walking through some of the architecture, so that hopefully this will serve as something that's useful for you as well. This app has already been well accepted by the group that we've implemented this in. We're in stage testing now with a plan to extend the pilot over the course of the year to those other counties. So my call to action to all of you, and as we're seeing more GDEs extend from use of AI and from lowering that barrier of letting us come up with these ideas in a way that can actually impact. all of you has the opportunity to become a stronger developer than me. And frankly, it's great that I'm on here as a GDE, but in a collaborative environment, it's great to work together with each of you. I will never give up patient care. I can tell you in the last 3 years, I've cared for 8,500 patients. We'll round about 20 to 30,000 over a decade. I've taught 142 emergency medicine residents over the last 10 years, which rounds to about 2 million indirect patient lives just from the teachings that I've had on shift. I can tell you from the technologies that we've built and deployed and maintained for physicians, for patients, for families to screen for social need, the number of impacts that we've had as well. Thinking through these functionally sourced and open sourced opportunities, how much more could we do together? Let's be honest. As a developer, your risk of burnout is high. As an emergency physician, my risk of burnout is high as well. And when you're trying to think through, okay, so high burnout job combined with a high burnout job, what's the motivation there? Almost 15 years ago, on a shift with a emergency medicine, EMS, and tactical medicine physician in Franklin County, Virginia, Charles Lane, I asked him, why did you do all three? What's the point? Why not just pick one or just do emergency medicine? And he told me verbatim, I want to be the one who decides when I retire. I don't want the job to be the one that chooses for me. Think through your career path. Think through everything that you've done to date. And don't just think about the technology side of what's been, where you've applied your brains, because you're paid to use your brains in these settings. Think through the things that make you unique, that inspire you, and see how you can apply that to your life as a technologist and as a developer, especially as we're looking through the opportunities expanding exponentially from year to year. It's amazing. How much more could you do with that inspiration and that background in development and technology? And so I am an emergency medicine specialist. Some of my colleagues, Maureen Nosfor, Kinder Jackson, are pediatric emergency medicine specialists. My chair, Michael Gibbs, is an airway expert, and he's traveled around the country for over 20 years teaching people how to save a life when no other option exists at all. But from my perspective, we absolutely will care for every human, regardless of what the world is throwing at us, and save a life as best we can every day. And that's part of my passion. The other part is as a technologist and somebody who builds and works with healthcare data and FHIR. So this is me with my path for FHIR, and technology. And I want this to be hopefully some form of inspiration for you to take your elements that are outside of your traditional job and apply it in a way that is inspiring for you so that you yourself get to determine how and when you retire. For any who want to collaborate in medicine, please find me. Those are my socials, and thank you all so much.